until yesterday, the fight between Community Health Systems and Tenet Healthcare was a typical M&A standoff. Community Health wanted to buy Tenet. Tenet didn't want it to be bought. Then all of a sudden, this became one of, if not the best takeover story of the year. Tenet, in a Texas lawsuit, accuses Community Health of overcharging Medicare, the government health insurance program, by at least $280 million. Community Health shares plunged 36%, putting any potential deal in jeopardy. John Ransom covers both of these companies as head of healthcare research at Raymond James. He's on the phone this morning from St. Petersburg, Florida. John, have you ever seen anything like this?
No, it's unusual. You don't see hostile takeovers in this industry. And for one company to accuse another company of Medicare fraud is unprecedented in my 20 years of working with this industry.
It's early days yet, John, but do you believe, or are you inclined to believe, any of what Tenet put in this lawsuit? At the very least, there is a dramatic difference between the rate at which Community Health discharges patients, or at least admits them, and what is standard industry practice, including at Tenet.
We have worked with these massive databases before, and if you know what you're looking for, you can find numbers like this. So apparently these numbers have been confirmed by two different consulting firms, and they're based on public databases. So we're inclined to believe that, you know, there's almost no chance that Tenet would have gone public with these numbers had they been any question about them. I think the question is, are they going to matter ultimately? And I think that's an open question that won't be answered for a while.
Okay, so let's say they do matter. What does that imply? Does that mean that at the very least Community Health is going to face a federal investigation and possibly the kinds of fines and damages that Tenet suggests in the order of $1 billion? And what about the rest of the industry? Is it now going to be under scrutiny by the federal government and the Medicare cops?
Well, there's two issues here. In terms of the effect on Community's earnings, it's actually fairly modest. It's maybe 3 to 4% of their total EBITDA per year. The issue, though, is each claim is subject to treble damages, and each incident is also subject to an $11,000 fine. So they'd only collect about $3,300 extra per admission, but they'd be putting at risk up to $11,000 fine plus treble damages. So in theory, the government could cook up some infinite penalty. Now, the other thing I wanted to mention is, number one, we have not heard from Community. They've just addressed the street with a rather terse press release. And secondly, the government, there's not a big track record where third parties goad the government into doing your bidding. I want you to go investigate this guy. And I'll give you an example. I mean, look at how many times the SEC was told to go investigate Madoff, and they declined to. So it's hard for third parties to get the government to go investigate an industry. The one example I can't think of is the home health industry was looked at by Senate Finance Committee, DOJ, SEC after a Wall Street Journal article. So it's not unprecedented, but it is unusual.
Well, we'd like to believe regulators have learned at least a couple of things since Bernie Madoff. One last question, John. Does this, in your mind, effectively mean that the Community Health bid for Tenet is dead on arrival?
I don't know. Certainly with the stock down at 36%, as you mentioned, I think it's damaged the bid, maybe mortally, but I think we're still kind of in the third or fourth inning of this process.
Now, one last thing. Are you going to change your outperform rating on Community Health shares?
No, I mean, like I said, I think what the government typically does is they'll bleed a company about what they could afford to pay. We think Community could probably afford about $1 billion. The stock's gotten hit by $1.4 billion. So at this point, I think the damage is assuming that A, the deal's dead, and B, they're going to have to pay some fine. And I think it's early to make both those assumptions.
John, thanks for joining us this morning. John Ransom, head of healthcare research at Raymond James in Florida.